It won't be a surprise to most of you. If anyone has read the news in the last couple of years, you know that healthcare is changing, right? So we're seeing increased expenses. There's a lot of things that are changing in the environment as a result of that. It may even be hitting your own pocketbook. But what I thought we would do is just look at the change by the numbers. So the graph on the left here shows healthcare spending as a fraction of our GDP over the last 50 years. You'll see that it's going up and to the right. And 2014, the last year for which data was available from the government, we spent 17.5% of the GDP, 17.5% of the entire gross domestic product on healthcare spending. It was down $3 trillion. And we're feeling it, right? I mean, we're starting to hear about pressure on prices. We're starting to hear about healthcare premiums going up as some of that cost gets shifted to the patients. And we're hearing about it in terms of consolidation in the industry. Another phenomenon is happening. So the plot on the right actually shows the fraction of Americans that are insured, right? And you'll notice in the last couple of years, largely because of the Affordable Care Act, there's a very large increase in the number of Americans that are insured as well. And I do believe that even under a Trump presidency, there's going to be some impetus to provide a program for driving insurance amongst the population. So what's happening is that we're running out of room for growth in healthcare spending. We have more people who need to be treated, and we're all starting to feel the pinch, right? So we're feeling it as patients, and we're certainly feeling it in the industry. So our government also makes available the expenditure in terms of where this $3 trillion is going, so let's take a look. So more than half of that $3 trillion is going to hospitals. It's going to doctors and to clinics. About 9% of it's going to drug companies. About 3% of it is going to medical device companies. And then a series of other things, including, I think, notably a 7% that actually just goes literally to support the infrastructure of the insurance companies and the federal Medicare and Medicaid. And every slice in this pie is feeling it. So there is drive on every single one of these to start becoming more efficient. And we can see that in terms of consolidation. And so what's happening on private practices are being brought up and consolidated into hospitals. We see hospitals that largely had been independent for a long period of time consolidating into hospital systems, both regional and national. We're seeing consolidation of the drug companies. We're seeing consolidation in the insurance companies and in the device companies as well. And all of this is in an effort to drive more efficiency in the system. So let's look at another dimension. So now we know where the dollars are being spent. What is it being spent on? So according to the CDC, it's down to 86% of this $3 trillion is being spent on management of chronic diseases. And so that his chronic diseases include things like heart disease and diabetes, some types of cancer. But it also includes things like dry eye disease, which is what our company was focused on, and something that I'll tell you more about. And so what does all this mean? Well, something that's sending a little bit of a shudder through the industry is frankly that there's going to be a higher bar, right, in terms of providing efficient treatment. And so that's the technologies that are more expensive for incremental benefit, frankly, probably aren't going to get into the marketplace anymore, at least not as easily. So that's the bad news. But what's the good news is that there is a heck of a lot of opportunity out there. So you have this $3 trillion marketplace, this enormous industry that is literally changing under our feet right now. And there's huge opportunity because someone has to be an agent for that change, right? There's tremendous opportunity in this consolidation as well. So one of the things, and we'll talk about it a bit, that has actually hindered some of this change and change by technology is that there's very separate groups, right? I mean, you go get your broken leg fixed by one physician, you get your eyes fixed someplace else, and your primary care physician, who may have referred you to these places, can't even look up in their medical records to see exactly how that went, right? So that consolidation actually can be a real opportunity as well, particularly on the information technology side. And then layered on all this, there's really a tremendous opportunity in chronic disease. And so providing better or frankly, just more efficient ways to care for chronic disease.